Okay, we'll make this as simple as we can. A lot of symptoms, but whooshing in the ear, headaches for a year and a half, a headache for a year and a half, lying down is worse, pulsatile tinnitus, neck pain. Well, after we adjusted you, you could breathe easier, the colors were more vibrant, you could see better, you could think better. Oh, the human side of this. So you had a year and a half of going to doctors, you had medical PTSD, went into a deep depression, as one would, didn't feel like you were getting much satisfaction, and well, you weren't. And anyway, so you've been in a depression for a year and a half and suffering a lot of symptoms. Well, the good news is you're doing great now. You feel like you got set free. Is there any symptoms you want me to talk about? Because I know you want this video to help people.
Yeah, pulsatile tinnitus, pressure on the head, jaw pain, neck pain, shoulder pain, facial pain, and sometimes up to the right eye.
Right, and you'll feel like you got a toothpick in your throat too.
Absolutely.
Right.
Yeah.
Right. Okay. All right. So let's come around here. Let's show you what we found, and why you're feeling so much better, and what still needs to be done. Okay, so what we did is we did a 4-phase CT scan with contrast. We did an arterial phase, and then we dissected it and pulled you all apart and found out what the arteries are doing. We did another venous phase in the neutral position, and we'll show that in a moment. We also did a venous with the right head rotation, and we can dissect that a little bit too. So we spent a few hours dissecting everything and doing a deep dive. So let's go ahead and zoom in on this. So without going into too much history, when you were a little girl about 7 years old, you had an injury where you landed on the right side of your face and you never really felt the same sense. So here we're looking at the internal carotid on the right that is displaced. It's not running through the same path as the left one. So let's call the left one straight up and down, normal, neutral, in a good position there. That's kind of where we want it to be. And the left side is, I'm sorry, the right side here is showing some trauma. So there's a fascia, a carotid sheath that holds these two together. Clearly you can see the calcified styloid ligament that is in play and not only entrapping the jugular, but it's displacing some of the soft tissues in here. And one of the things we ended up doing was going in the back of your throat. We turned your head to the right so we can get in there, and we moved this from medial to lateral. It's very tender back there. There's some trigger points in there, and it seemed like this compartment is swollen and under pressure, and that helped a lot. Actually, that helped it, made it to where we could get a good adjustment on you. Okay, so that was what we really saw on the arterial phase, other than the fact that your head is crooked over to the right. And actually, we're going to go into the screenshots because we already dissected this thing pretty good. All right, so this is the highlights. This head has been tilted over to the right a long time, and I can show that because the superior or the inferior articulating facet of the atlas is far larger on one side. So the head is as heavy as a bowling ball, and this loading on the one side has been going on for quite a long time. Left side, yes, we have venous congestion in there. Kind of what you look like lying down, and you look like that upright too. We looked at some of the other veins, make sure there's no congestion and compression anywhere else, and there's not. We did find some calcification of the arterial system there. Somebody else will evaluate that. All right, so we drew a line through the center of the foramen magnum, and then we added the atlas. So here, this is the right side of the head, this is the left side of the head. We're looking up from the bottom. You can see how much larger this is because we believe it's been under a load for a long time. You can see the styloid entrapping the jugular there, and it is on both sides. So this tells us the mechanics have been off for a while. There's the measurements. Right, so this is probably the single best screenshot of the whole thing. So you can see the displaced internal carotid, how it's moved this way. That's why we came in there, to move that towards the correct position. The styloid, I think you're going to end up getting that removed before everything is said and done. We move the atlas in a beautiful way. That's why you're feeling like you can breathe easier and all kinds of things. Taller, lighter, colors are more vibrant. We're just glad that you kind of got set free in a big way, and that depression kind of went away too. That's nice. Okay, so mechanically, what are we seeing? Left head rotation, right head rotation. It's not moving like it should. When you turn your head to the left, the atlas goes up to the right. The atlas goes anterior on the left with left head rotation. On the right head rotation, the atlas is supposed to go anterior on the right, and it is not. There's a constriction, a blockage. There's something going on in the front there that's keeping it from its normal motion. It's a compound motion there. So of course we evaluated for hypermobility. You're not hypermobile. As a matter of fact, you're kind of stuck. You're not moving very much at all. There's a lot of calcification in here. To see, there is some movement in there. It's not stuck. It just looks like it. When you jut your jaw forward, the left condyle comes out of the fossa, no problem. The right one doesn't move, and it's stuck. And we went in there to, of course, work on the pterygoids, try to get a check for passive range of motion. It is stuck. It is not moving. It's not just that you can't move it. It's stuck. Then we showed left and right head rotation. Look at this. It's not moving hardly at all. There's a monkey wrench in there. So in the neutral position, it measures anterior on the left 3.5 degrees. With left head rotation, it jumps up to 6 degrees. And then with right head rotation, it should come down to 0 or 1, and it goes up to 4.5 degrees. So there's a paradoxical movement in there. The compound movement of tilt and rotation is not normal. There's a good view of the styloid. Some of the pterygoid that we released. Rectus capitis lateralis, rectus capitis anterior. Those are the muscles that are engaged and hypertonic. Okay, so on X-ray you look beautiful, nice curve there. That's exactly what we're looking for. So this is the before and after X-ray. We adjusted you from right 30, posterior 40 to get that active tensegrity coupled movement correct. The plane line went from, you can see how crooked this is. The atlas was 12 millimeters higher on the right, and it dropped down to 7 millimeters higher on the right. Significant improvement there. This is the center of gravity at C7. You can see how much the weight shifted over. And of course you feel amazing, set free, and colors are more vibrant, feeling taller, lighter, a lot easier to breathe. Didn't even know you had trouble breathing. More sure-footed, all kinds of things. And we expect that to get better as the days go by. The pain's coming out of your neck. The headache you've had for 1.5 years is gone. All those are the doctors in Canada we want to send you to. Those are the doctors for you to pick from. Anything you want me to talk about? So we 3D printed it. You can see some of the asymmetries, that the atlas is up on the right, spinous is rotated to the right. We adjusted her posterior 40, right 30. There's the styloid you can see, giving her some trouble. Yeah, so we're going to send you to somebody that's going to get that removed, and I think that's going to help that toothpick feeling. Right. So, yeah, once all this little compartment gets fine-tuned and fixed, I think you'd be very happy.
Yeah.
All right. Anything else? Okay, thanks.
Thank you.